Have you ever felt a slight discomfort and thought nothing of it? Most people do. But after the age of 60, your body starts giving different signals. Signals that often go unnoticed, but can hide serious risks. Pain doesn't always come on strong. Sometimes it disguises itself as fatigue, dizziness, or a simple change in digestion. That's where the danger lies. In this video, we're going to talk about 7 symptoms that may seem common, but could be warning you that something much more serious is happening. And most importantly, what to do if you notice any of them. Ignoring these signals can be an irreversible mistake, so it's worth paying attention until the end. A little discomfort could be the beginning of something that needs to be treated urgently. At this stage of life, your health requires a closer look. After 60, your body responds differently. A symptom that used to pass in a few days can now turn into something serious. And that's exactly why understanding what your body is trying to tell you is so important. When you know the warning signs, you act faster, seek help, and prevent something small from becoming a big problem. And that's what we're going to show you here, the symptoms that should never be ignored. If you care about your health or the health of someone close to you, go ahead and subscribe to the channel and give us a thumbs up now. This helps us continue to bring you useful and important content like this. And who knows? The information you're about to hear today might just save a life. Some symptoms appear so subtly that they are easily ignored. A cough that won't go away, a little pain in your chest that appears from time to time, unusual tiredness. Many think it's just part of getting older, but that's not quite the case. These signs, when recurring or without an apparent cause, can be your body's warning that something is out of balance, and ignoring them gives a condition room to worsen without you realizing it. The first symptom you should never ignore is a sudden loss of weight without dieting or exercising. When your body loses weight spontaneously, something inside is consuming energy. It could be anything from hormonal problems to silent cancer. Monitor it carefully. Another symptom that deserves immediate attention is shortness of breath, even during simple activities. Climbing a flight of stairs or walking for a few minutes shouldn't cause breathing difficulties. If this starts happening frequently, it could be a sign that your heart or lungs are being overworked. Often, your body is trying to compensate for something that isn't working properly. This could indicate heart failure, pulmonary embolism, or even more serious problems. Don't wait for the situation to get worse. Even if it seems like something that will pass, shortness of breath should never be ignored, especially after the age of 60. And when it's accompanied by extreme fatigue or chest pain, it's even more urgent to see a doctor. Your body usually gives you warnings, but you need to know how to listen carefully and act responsibly. Changes in speech or coordination are also warning signs. Many people don't associate these symptoms with anything serious, but sudden changes in speech, balance, or strength on one side of your body could be the first signs of a stroke. It's common to think it's just a temporary ailment, something that will pass with a little rest. But time is a crucial factor in these cases. The faster a person receives medical attention, the greater the chances of recovery. So if you or someone close to you shows any of these signs, even for just a few minutes, don't hesitate to seek medical help immediately. A stroke can leave permanent damage, and in many cases, it can be prevented if identified in time. Knowing these symptoms is a way to protect yourself and those you love. Chest pain is another classic symptom that many still underestimate. Sometimes it appears as a slight pressure, a discomfort, as if something is squeezing the area. It's not always a sharp pain, as many imagine. Therefore, it can be confused with digestive problems or muscle tension. But any pain in the chest area, especially if accompanied by cold sweats, nausea, or pain radiating down your left arm, should be taken very seriously. It could be a warning of a heart attack, and a heart attack, when not treated in time, can be fatal. After the age of 60, the risk increases, especially if there is a history of high blood pressure, diabetes, or high cholesterol. Therefore, attention to detail is essential. Your body talks, and understanding its signals can be the difference between life and death. Another symptom often ignored is sudden mental confusion. When a person who has always been clear-headed starts forgetting basic information, gets disoriented easily, or has difficulty maintaining a coherent conversation, it's a sign that something isn't right. It's not just natural aging or common forgetfulness. It could be a sign of infection, metabolic imbalance, the beginning of dementia, or even adverse effects of medication. In some cases, this confusion may indicate problems with the liver or kidneys, which affect brain function. The most important thing is to observe the frequency and intensity of these changes. Any sudden change in mental behavior should be evaluated by a professional as soon as possible. The earlier the diagnosis is made, the greater the chances of treatment and recovery. Unexplained bleeding also deserves special attention. Small amounts of blood in your stool, urine, or even gums that appear without an apparent cause can be signs of serious illnesses. Many believe it's something simple, like a hemorrhoid or gingivitis, but this type of thinking can delay the diagnosis of diseases such as colon cancer, severe urinary tract infections, or problems with the blood clotting system. After 60, your body no longer responds in the same way, and any change should be investigated more thoroughly. If this bleeding persists or becomes recurrent, it's essential to see a doctor. Prevention is still the best way to take care of your health, and acting early can avoid more aggressive treatments in the future. Ignoring these signs can have irreversible consequences. A frequently underestimated symptom is persistent pain in specific areas of the body. It often appears in the back, hips, or joints, and is attributed to aging or poor posture. However, pain that doesn't go away with rest or medication, and that returns frequently, may be related to more serious problems. Some conditions, such as bone tumors, deep infections, or autoimmune diseases, manifest themselves this way in the beginning. It's important to observe if the pain is limiting your movements, affecting your sleep, or making simple daily activities difficult. In these cases, you shouldn't accept the pain as a normal part of aging. Seeking medical evaluation is essential to investigate the real cause and act accurately. Your body warns you when something is wrong. You just have to have the courage to listen. The constant feeling of fatigue is another sign that needs to be observed carefully. Many people over 60 think it's normal to feel tired frequently, but there's a difference between common tiredness and fatigue that interferes with your routine. When a person sleeps well, eats properly, and still feels exhausted when performing simple tasks, it's a warning sign. It could indicate heart problems, anemia, hormonal disorders, or even silent chronic diseases. It's important to observe if this fatigue is accompanied by other symptoms, such as paleness, shortness of breath, or dizziness. The mistake is to get used to this state and not try to understand the cause. Identifying the origin of this exhaustion early can completely change the course of your health. Never accept as normal what used to be easy and has now become an effort. Recurring dizziness also deserves extra attention. Feeling like everything is spinning or having a loss of balance may seem like something minor, but it's not. In older adults, this dizziness can result in serious falls, fractures, and even hospitalizations. But in addition, it can be a symptom of problems with circulation, blood pressure, or even the brain. Some dizziness is linked to the inner ear, but others have neurological or cardiovascular origins. What defines the severity is the frequency, duration, and associated symptoms. When dizziness comes with blurred vision, slurred speech, or numbness, it may be a sign of something serious. In any case, you shouldn't ignore it or just wait for it to pass. Investigating the reason with medical help is the only safe way to know what's really going on. And acting in time makes all the difference. Changes in bowel or urinary function should always be taken seriously. Many people believe that changes in this regard are normal with aging, but the truth is that the intestines and bladder are like sensors that reveal the general state of your body. Constant constipation, frequent diarrhea, urgency to urinate, or difficulty emptying completely can indicate everything from infections to problems in the nervous system or tumors in their early stages. Observing the pattern of these symptoms, the presence of blood or pain during the process is essential. When you notice any persistent change, the safest thing to do is to see a professional and have simple tests that can reveal a lot. Normalizing discomfort is one of the biggest mistakes made at this age. Care is in the details and in listening attentively to your own body. It's common for us to adapt to small discomforts over the years. One day it's a slight pain, another day it's an unexplained nausea. and so we develop a tolerance to signals that would have made us run to the doctor before. But this silent adaptation is dangerous. Your body doesn't send signals by chance. Each symptom, no matter how small it may seem, is an attempt to communicate. And after 60, this conversation with your body needs to be daily. Ideally, you shouldn't wait for the discomfort to become unbearable to act. After all, the sooner you discover the cause of a problem, the greater the chance of treating it successfully. Preventive medicine is the smartest path to a good old age with quality of life. Listening to your own body isn't drama, it's wisdom. And often that's exactly what can prevent a tragedy. There's also the emotional factor, which is often ignored. Mental health directly influences physical health. After 60, feelings such as constant sadness, discouragement, loss of interest in activities that were once pleasurable, or sudden mood swings can be signs of depression or other emotional disorders. Ignoring this, thinking it's just a phase, can worsen the situation and impact the entire body. Your body feels the weight of your mind, and this manifests itself in aches, changes in sleep and eating habits. Seeking help isn't a sign of weakness, but of courage and lucidity. Taking care of your mental health is as important as having blood tests or controlling your blood pressure. Comprehensive care, which unites body and mind, is what guarantees true well-being. And that goes for all ages, but especially for those in the most delicate phase of life. It's important to remember that most serious symptoms start silently. They don't appear overnight. That's why paying close attention makes such a difference. The secret lies in the repetition, the persistence, and the change in what has always been normal. If you feel that something isn't as it used to be, even without pain, even without obvious signs, don't ignore it. Making an appointment, having a simple exam, talking to a professional, can bring relief or reveal something that deserves immediate care. Health doesn't wait. It requires action. And this conscious attitude can not only prolong your life, but also ensure that it is lived with more autonomy and dignity. Prevention is the best answer we can give to time, and taking care of yourself is a commitment that starts with attention and ends with gratitude. There is a false idea that aging is synonymous with suffering or limitation, but the truth is that, with attention and care, it's possible to live well and with energy even after 60. The key is not to normalize what bothers you, not to accept discomfort as an inevitable part of aging. When you know the signs of your body and act early, you take control of your health. It's not about being afraid, but about being aware. And that awareness begins when we stop ignoring the small warnings and start treating them with the importance they deserve. Each visit to the doctor, each exam done in time, each decision to investigate something apparently simple can avoid complications in the future. Responsibility for your own health is, first of all, an act of love for yourself and for those around you. Many avoid seeking help for fear of the diagnosis. They think that discovering something serious will be worse than continuing without knowing. But the reality is the opposite. Ignorance doesn't protect anyone. On the contrary, it postpones solutions, delays treatments, and increases risks. Information is a powerful ally. Knowing what's happening to your body allows you to make decisions, choose paths, and act quickly. The sooner a problem is discovered, the greater the chances of cure or control. Don't let fear paralyze your attitude. Time in this context is more valuable than any medicine. Every day counts, and every choice made consciously can completely transform the course of your life. Healthcare should be continuous, active, and without excuses. Another important point is active listening during appointments. Often due to shyness or thinking that the symptom isn't important, people end up omitting valuable information for the doctor. Don't underestimate any detail. If something has changed in your body, even if it seems silly, talk about it. Sometimes it's precisely that detail that helps in the correct diagnosis. Healthcare professionals need accurate information to help effectively, and that only happens when there is clear and open communication. It's not time to be sparing with words. It's time to prioritize yourself. Value every sign from your body, every change. This care begins in your speech, in your willingness to listen to yourself and be heard. And this habit saves lives. As the years go by, it's common to hear that certain aches or discomforts are normal for those who are over 60. But you need to differentiate what is common from what is dangerous. The normalization of silent suffering is one of the biggest traps in this phase of life. Your body ages, yes, but that doesn't mean it should be ignored when something changes. Feeling pain frequently, living tired, or suspecting that something is wrong and not seeking help is a risk that no one should run. Aging with quality is possible, but it requires vigilance. What seems small today may be the beginning of something that grows over time. Therefore, it's essential not only to have routine exams, but also to be aware of what is different in your body. Prevention begins with observation. It's also essential to maintain a lifestyle that promotes health. Balanced diet, adequate sleep, light physical activity, and social interaction are factors that contribute to the proper functioning of the body. But even with all these precautions, the symptoms we mentioned here shouldn't be ignored if they appear. They don't disappear with a simple walk or with natural teas. They require investigation. A well-cared-for organism responds better to treatments, and therefore those who take care of themselves regularly are always one step ahead. But that doesn't cancel out the need to be attentive to the signs. The combination of prevention, healthy habits, and attention to symptoms is the safest path to a long and stable life. Care needs to be constant, even on days when everything seems fine. What many people forget is that health isn't just the absence of disease. It's feeling good, with energy, with mental clarity, and the energy to do what you enjoy. When any of these aspects start to fail, it's time to stop and observe. The purpose of this video isn't to create alarm, but to stimulate a more conscious attitude towards your own health. It's about responsibility with the body that has sustained a lifetime and now needs full-time attention. Each of the 7 symptoms we covered can be the beginning of something more serious, but it can also be a sign for you to act in time. Information is your ally, and knowledge is the first step to change. Valuing your own health is a gesture that reverberates throughout your family, your friends, and those who depend on you. Throughout this video, we've seen how 7 apparently simple symptoms can actually be important warning signs from the body. After 60, each sign should be taken seriously, without rushing but also without delay. Life at this stage can be rich, active, and full of meaning, but that depends directly on caring for your health. Many serious problems could be avoided or treated more effectively if they were identified early on. And that's why we reinforce: don't ignore, don't postpone, and don't underestimate what your body is trying to show you. Listening to the signs, seeking help, and having regular exams are life-saving actions. You don't need to live in fear, but rather with attention and wisdom. Healthy longevity is possible and starts with simple decisions, made today, not tomorrow. If at any point during the video you identified something you've already felt or noticed in someone close to you, consider this an invitation to act. Don't wait for the symptoms to get worse to seek guidance. Talking to a healthcare professional, getting a checkup, scheduling that appointment you've been putting off are concrete steps to guarantee more years of life with quality. And if you found this content useful, share it with those you love. Sometimes, a simple piece of information can completely change the course of someone's life. And if you're not yet subscribed to the channel, take this moment to subscribe, like, and leave your comment. This shows us that you care about your own health and helps us continue to bring important topics to your daily life. Taking care of your health after 60 isn't a burden, it's a smart choice. It's recognizing that each phase of life has its particularities, and that the body over time begins to communicate differently. The 7 symptoms we shared here aren't cause for panic, but rather a call to responsibility. The attitude you take today can guarantee more peace of mind tomorrow. Value your health, take care of yourself attentively, and allow yourself to live with more lightness and security. The right information at the right time has the power to transform. And if you've made it this far, you've already taken the first step. Thank you for watching and for choosing to be attentive to what really matters.